All right,
There you go.
great. I don't think you're seeing my screen yet. Let's go back to that.
Good
Great.
to go.
All right, cool. Thank you. Thanks, everybody. Oh, I bombed out again.
We can hear you, Kim. We just your camera's not on.
Yeah, it was. All right, great. Thank you, everybody. Thanks for your patience. We'll get started right now. I'm Kim Sterling. I'm Vice President of Professional Services for NCCHC. We welcome you here today. With me is Rich Forbes, our Vice President of Program Development, and we'll be splitting up the presentation today. Please feel free to put any of your questions in chat while the presentation is going on, and we will try to get to them. And then at the end, it can be a little bit more free-flowing. So the first half of the presentation will be just introduction to the conference, where to go, what to expect when you get there. And then the second part is kind of an orientation to NCCHC, the services that we offer, and how we can help you and your patients and your facility. So hopefully you're here on purpose, and we appreciate your being here. So let's just make sure that the screen. Oh, crud. All right, sorry. This happened to me before. The slides are not advancing. There we go. Okay. Oh, again, thanks for your patience. All right, so here's our agenda. This is what we'll be talking about, and we will get right into it. So the first thing we have is a poll, so we can understand who's here, and you can understand who's here as well. So I will launch the poll.
Hey, Kim, I'm not seeing your slides advance. I'm sorry. I didn't mean to cut you off, but I'm not sure.
No, appreciate it.
Yeah.
Oh, gosh darn it. This is what happened last time too. One more time. I am screen sharing from the beginning. Slideshow. New share. Now let's try this guy. All right, I'm gonna share them right from the back end, and I really apologize. We got on early and we practiced and we were all set to go.
Yeah, that's strange. That was working fine.
Yep.
There, okay.
All righty. All right, we'll try again to launch that poll. All right, did the poll come up? Yes.
Yes.
People are answering. All right. So if this is your first in-person NCCHC conference, let us know. And pretty high percentage there, which you appreciate. Somewhere between 70 and 80%. 73% we're at. So appreciate our repeaters. Could be a while since you were on the on something with us, or could be just very curious to have a question you need answered. So we are very glad that everybody's here. So thank you. All right. So let's talk about what we're going to cover, and that will be tips on finding your way around, navigating the event. And the number one question we got asked is on claiming CE credit. So we will get to that as well. So before you leave, I assume that you've seen our website. Do go to the website. Oh, sorry, one book housekeeping note. You will get a copy of these slides with all the links are live on it. So you don't have to worry about keeping track. But on this slide, we do have a specific link to the overview of the conference, which we suggest that you do go to. take a look at everything that's going to be taking place and start thinking about what you'd like to go to. Yesterday, we sent out the app invitation, so you do have the opportunity to log into the app and add sessions to your own personal schedule, and we have a slide on that as well. Another thing to do before you leave is go into your my.ncchc.org account and go to your conference proceedings. Spring 2024 is up there now, all of the presentations that we've received from the speakers, and unfortunately, a lot of them do come in late, so you can kind of keep checking back, and some of them will even go up next week or right after the conference. But if there's ones that you want to download and print and take with you to take notes on, you can do that today before you leave the office. So you'll have them, I'm sorry, the conference is in a week. You can do that anytime next week and you'll have ample chances and time to do that. Now let's talk about how you're going to get there. Most people are flying in, so you'll be getting to the Marriott from the airport. This is a link to ground transportation that the airport provides. If you're on a tight budget, there is a rail line, which is really nice and convenient, about a half hour and $4. So you can't beat that. And it's extremely close. The station is like a couple minute walk. It's the convention center station. You can buy a ticket right at the vending machines at the airport before you go. And we will ask if there's any native St. Louisans on the call today to please chime in the chat if there's anything that we're missing that you'd like to point out. Of course, full service airport, taxis, Ubers and Lyfts, and those are the approximate prices. And it saves you just a little bit of time. So lots of options. We say this basically at every conference, no need to fly in and rent a car unless you've got other travel that you're planning to do. It's just mostly a hassle to have a car in a big city like this. So we will be downtown. And this is a map that we got from the hotel, and the Marriott Grand is right here where this little red arrow is, and it's right next to the convention center, so pretty hard to miss. We are, as you can see at the bottom of the screen, right off the Mississippi River, real close to the arch. So you'll be able to go over and take some pictures there when you have a free moment. There's a big area, a large restaurant entertainment complex called Ballpark Village, which is on the left side of the screen, which looks like a big stadium. But right across from there, there's a whole bunch of restaurants and entertainment. This is just a couple blocks away. Of course, if you're not comfortable walking in a city or, it's late, please feel free to grab a cab or take the public transportation or, travel in a group. But we've been assured that, it's pretty lively and you should be pretty comfortable down there. This link will take you to a PDF that the hotel gave us of all the restaurants that are within walking distance, and it's 2 pages. So nobody's going hungry at this event. If we look at the Marriott, where do you go when you get there? So on the right side of the screen, it says hotel meeting space. That's basically the tower where everybody will be staying. So in order to find your meeting rooms, you're going to take the elevator down to the lobby level, which has the blue star next to it. And some of our programs, especially our weekend committee meetings, will be taking place on that mezzanine level and that gateway level. But for most of our conference attendees, you're going to follow the signs that say down to the conference. And you're going to basically take an escalator down and you will come out in the Marriott Ballroom Plaza meeting space after walking through a short walkway. And you will go up 2 levels to the Majestic Ballroom level. And in the foyer, there will be the badge pickup. There will be adequate signage, so please don't worry that you need to, memorize directions or anything. But just so you know, the hotel is a little split with the meeting space in 2 different areas. And the registration will be here in this foyer that says badge pickup right outside the Majestic Ballroom. Using the app, highly recommended. I will linger just a little bit longer on this screen because this is the app QR code. So you can take a picture of that with your cell phone and put the app on your phone. The app is called Attendee Mobile. And all you need to do is search for NCCHC or search for NCCHC Spring, and our 2024 event will come up. And you can use the app just fine at that point. It will give you a schedule, information about the speakers, information about the exhibitors and the sponsors. A little map will be in there. But if you want to go to the next level, you can log in, and that will allow you to see the other people who are registered for the conference, as well as setting your own personal agenda. So you will have a ready reference for where you want to go. So that you can do now before you even leave the office, and you can play around with that. And we have sent the link out to you just yesterday. I sent the link out to everybody, and that will go out again next week. So I'll just pause on that for a second. And I don't see anything in the chat, so we will move ahead. So when you get to the meeting, as we said, you'll go to the Majestic Ballroom level, and that will be that escalator from the lobby, and look for the signs that say badge pickup. If you are a regular attendee or speaker, you'll be going to the regular badge pickup area, and you'll pick up your name badge and your conference bag. If you're an exhibitor, please go to the exhibitor registration line, and you will also get your name badge there. This is a little bit of a pro tip that other people may not know, but occasionally right before the pre-conference sessions start on Saturday morning, if you're there for one of our full day seminars, there may be kind of long lines. Rather than standing there and freaking out, you can go right to the pre-conference seminar room, check in there because we do have your names on a list. And then at the first break, you can go back and get your name badge in your bag. It's not the recommended sequence of events, but if you are starting to get really nervous or it took you longer to find the room and you're, running a little late, that is a permissible activity. Let's talk about getting the most out of the meeting. Once you're there, there's a lot of, on this call, we have a lot of first timers. We've got a lot of people who may not have come with a team of people. So I'm not going to go through these, but this will be in your saved slides. Just a list of conversation starters and icebreakers, if that's helpful to anybody. So what's going on day by day? Saturday and Sunday are pre-conference seminars that require an extra registration fee. You can go in today and update your registration if you're not registered for a pre-conference seminar. You did receive that information when you received your confirmation for the conference. So on Saturday, we have 3 pre-conference seminars that go all day on our jail and prison standards, mental health standards, and juvenile standards. There will be some coffee and light refreshments out in the morning beforehand. It's not really breakfast, but consider it a coffee break. And then if you want to come by and buy any standards, or we've got some nice NCCHC apparel this year, the store where I will be open from 10 till 2. On Sunday, we have 2 pre-conference seminars in the morning and 2 in the afternoon. And these are on nursing and MAT and mental health and something else that's escaping me currently. But if you're curious, please do go ahead and check the website. Again, we'll be starting with a quick coffee break. The store will be open from 10 to 3 that day. If you are coming in for the CCHP or specialty exams, you can sign in on Saturday or Sunday, and they will tell you what room to go to, and you'll be all set to take the exam. New this year, new in the last year, is that they will be doing grading on site. So if there isn't any issues or problems with that, you may actually get notified if you've passed before you leave St. Louis. So that's kind of an exciting thing. I'm sorry, there's fire trucks now going by. Okay. And then we hope everyone will join us at 5 o'clock in the exhibit hall for the opening reception, which goes from 5 to 6:30. So our registration desk will open at 8 a.m. both days. If you have any questions, please feel free to stop by the registration desk or the bookstore during the hours that it's open. We can help you out with general questions as well. Here's some more daily highlights for what's going on Monday and Tuesday. Jessica just asked a question about a pre-conference seminar for a study session for the CCHP. Yes, that's one of the full day sessions on Saturday. They'll go through all the important highlights of the jail and prison standards, and that will actually help you quite a bit prepare for the exam. That is $99 if you register today. If you wait to register on site, that'll be $125. So that is available to you, and there's a wonderful pass rate. That full day seminar does a terrific job preparing people to pass the exam, and most importantly, getting you familiar with all the important parts of the standards. So highly recommended, and usually have a really nice turnout for the those pre-conference seminars. Monday, there'll be a little coffee in the morning, some light refreshments, and then we have a plenary session at 8 a.m. on prostate cancer. And right after that, we will go into exhibit hall, and we'll have a light breakfast in there, as well as visit to the vendors. And again, NCCHC store is open if you need to buy any standards. All during the day, you will have your choice of educational sessions. You can go to anything. The content areas that are shown for those sessions are really just to give you an idea what it's about. You're not limited in any way, outside of the fact that some presentations are not approved for CE by the psychologists. So if you look at the grid to the right with that orange banner on it, some of those sessions have asterisks on them, and that means that they are approved by the American Psychological Association. For everybody else, you can basically attend any session that you like. So when you do pick up your final program, the schedule at a glance will have these pages. The final program will have this schedule at a glance with these final pages that will show you every session taking place, what room it's in, and who the presenters are in the content area. So that's a nice handy reference for you, and that's only like 4 pages in the book. If you want more information, if you page to the back of the book, every session will have a listing, an abstract, as well as the educational objectives. And all of the stuff is both in the printed book as well as in the app. So all available to you, and hopefully that will really help you get the most out of your conference experience. Tuesday morning, bright and early. I'm sorry, one more thing on Monday. Foundation reception starts at 5:15. Free reception, food, beverages, and music open to all. Great chance to hear from a few of our 15 scholarship winners. We're going to be hearing from, I think, 3 of them. And then some great time for mingling and networking. And we hope that everybody will be there for that. That takes place in the Statler Ballroom. You won't be able to miss it. Tuesday morning, roundtable breakfast discussions. Come on down, get some breakfast, get caffeinated, and have some good conversations on a variety of topics. Those are, again, in the app, in the final program, and there's actually even a sign in the room for what's going on. Back to our educational sessions at 8:15. We invite you back into the exhibit hall at 11 for our last break. And then there's a raffle with fun prizes. So I know a lot of you are first timers, haven't done this before, but it will be anything from like electronics equipment. Sometimes we have hotel stays at our future venues, some free registrations at future events, any kinds of good stuff. So we hope that you will be in there for that. And then from there, we'll all move as a group to our product theater lunch, which is on medication-assisted treatment. And from there, we've got more sessions, and we adjourn at 5. And one last chance to shop for your NCCHC stuff in the store from 9:30 to 1:30. So that's the whole conference. We'll be done at 5, and I hope you'll stay till the end and get all the CE that you are entitled to and get the full experience. If you've come this way, you know, we hope you'll make the most of it. So first question we normally get is, how do I get my CE and my certificate? You'll go right back into your my.ncchc.org account, and it has a link that says claim my CE. You go in there and you rate the conference, you rate your sessions, and then when you're done at the end, you hit submit, and you can email yourself a certificate. And that way the certificate is always there if you need to go back and get it again as well. You don't have to do them all right away. You have 6 months, So please take your time and don't hit that submit button until you're actually done with all the sessions that you attended. I went through all that kind of fast. I'm looking in the chat. I don't see any questions. Are there any other questions on what to expect when you get to the conference? All right. That is fine. If anything else occurs to you, just pop it into the chat. That is a-okay. And I will turn the session over to Rich. And Rich, just tell me when you want me to advance the slides.
Okay, Kim, sure will. So we'll go ahead and start off, folks. Welcome again to the introductory conference here, and welcome to everybody that's going to be coming for the first time. We're excited to meet you in person on site. So congratulations on making that commitment to come out. So what I'd like to do with this, we'd like to talk about NCCHC's origins, where the organization came from. So everybody, you may have seen it on our site. We were originated in 1983 and established, but prior to that, the American Medical Association, the American Bar were already working on a set of standards for jails, prisons, juvenile facilities, due to the inadequate healthcare. Everybody here should be familiar with Estelle v. Gamble, which established the constitutional right to healthcare while somebody's in custody. The AMA and the American Bar were actually working on this about 4 years before Estelle v. Gamble, and they had actually developed the first set of standards just before that landmark ruling came out. So it was very good timing on their part to take the lead on that. They actually held the program that we do now with our accreditation. They actually held that program up until 1982. A nonprofit was established. The AMA turned that over, and then in 1983, that nonprofit became the NCCHC. So we've been around for 41 years this year as an organization and committed to improving the quality of healthcare in our correctional facilities. The NCCHC standards are something I'm sure everybody's familiar with and heard about. So we have our standards, and I'm going to go over them in detail here, but our standards outline constitutional level care and best practices. And those are those nationally developed standards. We have 32 different organizations now that actually contribute through our committees and through our guiding group that actually basically kind of drive this whole process here. So it's not something a few of us sit in a room and do. We have people from every discipline, including our custody side and legal and the AMA that are still involved with this process. So it's a very comprehensive process, very thorough. And we are in the process of refreshing majority of those standards, except the juvenile ones who just came out. But the case did establish right to access care, right to care that's ordered, and the right to professional medical judgment that's independent of the correctional facility. And that's kind of the origin and the foundation of where we're at today and why we're here and why we do what we do. We can go ahead and move forward, Kim. Thanks. So what I'm going to talk to you about today, my role here as Vice President of Program Development is I basically go out and I engage new clients and existing clients. I try and match them up to services that might help them improve their delivery of care. So basically in a nutshell here, this kind of shows everything that I do on a daily basis in addition to some of the other duties I help out with the organization. But this is what I primarily talk to folks about. I talk about our standards, as I mentioned a minute ago. They set those benchmarks for that constitutional level of care in your correctional facilities. The professional certification program, we're going to go into detail on all these. I'm not going to read off of this, but accreditation, NCCHC resources, if you're not familiar with that, that's our consulting affiliate. The NCCHC Foundation, and Julie Huggins is actually here with us from our foundation, attending today. But our foundation is supporting research in the field. We're going to talk a little more about that. And then, of course, we're here already talking about the education conferences for the conference that you're going to be going to here next week, or the end of next week. So we can go ahead and move forward, Kim. Thanks. So NCCHC standards, we talk about quality care in correctional settings. We talk about that constitutional level of care. That's what our standards do. They establish that foundation and that framework of these standards. And it covers everything from your administrative side all the way to your operational. It also encompasses your medical, mental health, opioid treatment, and also custody as well. So there are basically everybody that's involved in that correctional setting, that's involved in that delivery of care, that monitoring of care, that ongoing quality of care are involved in this, from administration all the way down to line staff. And our standards cover that. If you're not familiar with them, obviously we will have copies on site. We'll talk a little bit more. And if you are attending one of the standard sessions, you'll learn in detail from our experts there about what those standards mean, how they apply with real life scenarios, talking about how those work. All right, move forward, thanks. And as I just mentioned, so we have our bookstore hours here that Kim has posted. Kim also alluded to those a moment ago. And the accreditation booth will be open during exhibit hours as well. If you want to talk to our accreditation staff, our vice president, our directors, and everybody will be on site to be able to answer questions real time. We have resources on site as well that can help you if you're looking, if you're not accredited already, it's something you're thinking about. We actually have our guides showing how that preparation looks, what you need to do to prepare for it. We'll have all that there for you as resources and available for you. So it's really it's really good you're going to this because we have everything centralized to be able to provide that for you. Next. So as I mentioned, we have 5 different individual accreditations. We have our health services in jails and prisons, and those standards are in the middle of revision now. Health services in juvenile detention and confinement facilities, those were revised in 2022. Our mental health services and correctional facilities are also in the middle of being revised. And then our opioid treatment programs and correctional facilities are actually being revised as well, in conjunction with SAMHSA, which just sent a bunch of direction down to our accreditation folks. So these are our 5 individual programs. Your jails and prisons, you'll notice when we do our pre-conference sessions, they do jails and prisons together because they're very close to one another. It's just different language with the difference between your pretrial confinement and your long-term convictions. That's the primary difference there in the quality of care and level of care, but they're very similar. Next, thanks. So going into accreditation, so I come from my background. I'm actually retired custody. I come out the Las Vegas Metro Police. I actually ran our jail out here. We were accredited my whole career, so that was where my relationship with NCCHC started from the first day of being an officer. Many of you that are attending this, you may work in an accredited facility, or you're seeking accreditation, or you're curious about it. But what it does, it basically certifies the credits that you're meeting national standards, providing that constitutional level of care, that efficient, well-managed healthcare delivery system we talk about all over our website and within the standards themselves. And one of the big things I like to emphasize coming from the custody side and being somebody in administration and command is the accreditation absolutely helps you with unfavorable legal judgments and costly liability. And that's a quote coming out of our manual, but I've experienced that where the fact we had accreditation helped us with lawsuits that came down. And we were able to show, no, this is what we do. We're able to show that pattern in practice where that actually helps with your facility's liability and your organization's liability. So it's very important that we hit on that. That's a big part of accreditation. That's very valuable. But other than that, just ensuring you're meeting that constitutional level of care and providing that level of care for the folks that are in your custody is the most important part, and that safety element. Next. All right. So we have what's called the Pinnacle Award, and I'm not sure if anybody's in the chat today. I know we have 30 some odd folks here today, about 34 of you. Pinnacle Award is a facility that's achieved all 3 of our accreditations. They've done the mental health, they've done the health services, and they've done their opiate treatment programs. We actually have several right now in the application process. They're actually going through this. We have a few that have actually achieved it at this point. But this is something we implemented to recognize folks with the highest honor of having that level of accreditation, is that you're hitting all of those major elements of your medical care that you're providing in your facility, and you're meeting those national standards and providing that constitutional level of care. So it's just something we do to recognize the folks that do that. So booth 107, our accreditation team will be there. These are our directors, our accreditation advisor, Carrie, and of course, our vice president of accreditation, Amy. They will all be on site. They'll be there to answer questions. We will have some of our surveyors as well. So it's a good opportunity to engage and talk to folks in person and get answers to questions you might have, especially if you are accredited and you have questions. They will always be your point of contact. If you're already in an accredited facility working with us, is you would always reach out directly to them. You have that avenue open to you to be able to get any type of answers to questions you have about interpretations, situations, things like that related to the accreditation. So it's a great tool to use, and they'll be on site to be able to talk to you. Great folks to stop by and have a conversation with. So I'm a little biased on that because I love them, but all right. So next, was there any questions at all about accreditation before I move on? And I talk a little quickly too, and I apologize for that, but I see a couple. Okay. Looks like you already have that covered, Kim, so I'll just move forward. All right. So next we'll go into professional certification. We don't do a poll, I don't think, for here. I won't do a poll or anything, but if you're not professionally certified, I'm going to go into what that program is. If you are a CCHP or you hold one of our specialty certifications, then you're already aware of this. We're going to cover it because we do have a lot of new folks here just to kind of discuss what it is. All right. So we were the first organization to do a corrections-oriented certification program that started in 1990, and it remains the largest program for correctional healthcare in the country. We have I want to say now it's about 4,400 possibly. It's definitely over the 4,000. Those numbers kind of sway. We did have a record year last year with new folks coming in and becoming certified with us. It is the most widely held correctional healthcare credential in the world. And the big thing is it shows that knowledge and mastery of standards. So there's a lot of keys to that. Everybody thinks, do I need to be an administrator to do this? Is it somebody who's a supervisory role? No. And the other thing is, it's not just medical either. I come from the custody side. I'm a CCHP, because it's a commitment showing that you understand your healthcare delivery and your healthcare services in your facility. This is not limited just to medical professionals. You can have your correctional professionals, and we really recommend it for the correction side. If you're an administrator, if you are a liaison, a medical liaison, or you're somebody that's in charge of a medical contract, even anybody that touches medical when you're involved in those administrative meetings, having an understanding of the why, and it's something I talk about a lot when I do classes, is understanding the why and the big picture. That's why this is such a good thing, because you understand the why behind the standards, and you understand how they apply to your facility and why they're so important to protect your patients, to provide that level of care, and your liability as well. We do have a new specialty certification that was introduced last year for clinical providers, and that actually covers your doctors, your nurse practitioners, and your PAs, physician assistants. These are our different programs that are advanced. These are the specialty and advanced certifications. Just to answer a question, because this gets asked every time, if you are not a CCHP yet, let's say you're an RN and you want to look into the CCHP RN, you do have to become a CCHP first before you can do an advanced certification. So just want to put that out there. And then your CCHP advanced, you have to have 3 years as a CCHP to be able to test for the CCHP advanced. Just to kind of clarify that, we do get asked that quite a bit. And we'll be happy to answer any questions on site as well. And I think our next one will show Matisa. Matisa will be there with her team. She's our vice president of certification. They will be at booth 111 at the conference there at the exhibit hall. If you want to come by and have any discussion with Matisa and her team about how the process works, or if you have any questions, you can also reach out to me as well. All right, so our education and meetings, and we're kind of right in the middle of this with our conferences. These are the big parts are conferences. We do 3 a year if you're not familiar. We have our spring conference that's always in April, right around that time frame. In July, we'll do a mental health conference. And then we do our national conference, which is the big one in October. So this year, July, if you haven't heard, is in Puerto Rico. October, we'll be back in Las Vegas. So those are our two that are coming up in addition to our one we'll be doing next week. So this keeps us very busy. And Mary's here with us. And I see Mary giving the thumbs up over there. Mary is awesome and handles business with our conferences. So everything you see that's coordinated here, that's Mary that's doing this stuff. And she works really hard to make sure the experience is great for everybody, and we appreciate it. So Mary, do you want to say anything? I saw you came off mute. So nope. Okay.
Just welcome everybody. Well, we'll see you at exhibitor registration. If you're an exhibitor, if you're an attendee, we'll see you in the hall.
Awesome. Thanks, Mary. All right. Yes, we also do additional education. We talk during the year, we do webinars, and we also do virtual conferences. So there's a lot of offerings for training. The big takeaway from those, though, and what's really great with the webinars, coming from an administrative side, is that when you have a lot of staff and you need to get them into training hours, right? And there's good topics come up. Sometimes it's really hard to get to a conference, to get to an in-person class, especially when you have a small facility, right? It's hard to get relief factor in there to get somebody covering the shift. So the webinars we offer, we cover a lot of the hot topics throughout the year, and you do get training credits, continuing education credits for attending those from the various certifications and various organizations. So you can apply that to your annual training hours and your requirements for your licensure as well. So they're definitely worth looking at on top of the conferences, of course, as well. And then NCCHC resources, since we're talking training, they offer consulting services. We do tailor-made training programs. For example, we do CIT, crisis intervention team training. We've done suicide prevention training. We do mental health specific training. We have a variety of experts who work with us as consultants. So we can tailor programs. If you're looking to do a particular program for a group on site or even remotely, those are the type of services we can actually do through our consulting. It's not just going in and looking at an operation because there might be some challenges or other issues going on. We actually do a lot with the education side and have a lot of demand for that as well. So we wanted to throw that in there tonight. All right. So our conference attendees, we kind of did our poll earlier and found out who has not been here before. And it's good seeing so many new folks coming around. Who actually attends? These are some breakdowns of the average numbers of who attends our conferences. And you can kind of see there's a big variety there. Now, custody law enforcement is relatively small. I come from that side. I kind of take that personal. I want to make that number bigger at some point. But when we do get the law enforcement custody, it tends to be administrators that are coming down, which is very important because that's your facility administrator calling the shots, maybe budgeting, and definitely that collaboration piece when you have the medical administration and custody administration. So it's very important. If you can persuade your folks to come with you and do these things, I highly recommend it. It's very, very big takeaways that come from these when folks see the big picture. Again, that education piece with me is very big. And I have found from attending these type of conferences and having those discussions on site you get a lot out of that actually helps your cause and helps your operation as well with the bigger understanding. All
I'm
right.
gonna launch a poll, and then there's also a question. So hold on one second, and we'll launch the poll. Let's just figure out who everybody is who's here. Great. So if you want to fill that in, did the poll launch? Rich, do you see the poll?
I don't. I actually was able to click into it and select some, but I'm not seeing the results.
No, I don't think it's working. I'm like a Zoom curse today.
But you know what, Kim, we might have to stop sharing. You want me to stop sharing the first one? That might be why it's not sharing.
Oh, yeah, you're
I
right.
just stopped if you want to try it again.
Okay, okay.
There
There
we
we
go.
go.
Cool, thank you.
Yep.
I got a question coming in and somebody asked if the CCHP exam is offered in other places, and yes, it is. The exam can be taken at a test center, and those are all over the country. And they actually also offer remote testing where you can do that at home or in an office. There's a lot of requirements about how empty the room has to be, but a lot of people take advantage of that. And then we are at local conferences as well. We'll be at the Wisconsin Correctional Nurses Association in 2 weeks. We will be at the AJA at the end of May. So the best place to come is to our website, www.ncchc.org/cchp. And there is a navigation link to testing options, and that will show you the calendar and will show you more information on the testing centers. So that's a definite option for you. And then if you are interested in the pre-conference seminars, you can do those in person, or we do have shorter versions available on recorded webinars, and that's on our website under education. So those have also been shown to be pretty effective. You don't get the advantage of being able to ask questions of the content, but it can be a really nice way to make sure you're getting the review that you need before the exam. So here is our results.
Good mix. Really good mix.
Yeah, really nice mix. A lot of mental health, a lot of nursing. Our nurses are definitely our backbone, both in our facilities and at our programs and our conferences. So cheers to all of our nurses for sure. But thank you everybody who is participating today. And this time I'm going to remember to hit stop sharing and send it back to you, Rich.
All right. And I did share the link for the CCHP directly in the chat. If anybody's interested in looking at that, it took some time to multitask there for a minute. So for more information, you've already met Mary. She was actually here and introduced herself, but these are our superstars here for our education and meetings. They will be at the conference, and they'll be all over the place. It says at the registration desk or the store, believe me, they're all over the place making things happen, and they are awesome the way they run stuff. But they're definitely worth hitting up and talking to if you have any questions about that, how we can help you out. All right. So NCCHC Foundation, again, Julie's here. Julie, did you want to talk about the foundation real quick, or do you want me to go into it?
You can go ahead.
Okay, sounds good. So Foundation's mission, we're championing that correctional healthcare field and serving the public, supporting research, professional education, scholarships, and patient reentry into the community. That's the mission statement for our organization. The priorities that we are working on now are juvenile reentry and workforce development through scholarships. And you will see at the conference, we have several of the scholarship winners that will be in attendance. They're there live and in person and getting to experience typically the first time coming in to see an NCCHC conference and getting to talk to their peers. Some of them are just entering into the field and gathering the information. Some are relatively new, but it is a very cool when we get to do these foundation presentations and we get to bring them in and let them come in and experience the overall environment. It is really great for their professional and personal development in the field. And we know how important correctional healthcare is, right? It's a very specialized field. It's very difficult. But we also find too, we get them in young. We get them in there young as far as the experience with corrections. We get them in there and get them right in that right environment. They figure it out. They love the correctional environment. It really is a great environment to work in, and it's underrated, to be honest with you. One of the things we are trying to do is that workforce development. We mentioned the scholarships, but we're trying to find those ways to get the information out, whether it's through colleges or job fairs, recruiting seminars, and that's something Julie is doing through the foundation to try and spread awareness of correctional healthcare just in general. Julie, I saw you came unmuted, so did you want to say something?
We've been working on videos, we did the careers and corrections, we did the nursing, we have a mental health that we're coming out with, and then physicians, I believe. And getting those to colleges and universities and just out there, they're being very well received. So we've got lots of things we're working on this year, some pretty exciting stuff.
Outstanding. Yeah, and when you get folks in here, a lot of folks come from different areas, whether it's community care, a hospital, or wherever. We really do see a lot of people take to the environment and really enjoy that. I was just in Georgia last couple of days doing a little conference down there, and it was the same thing talking to their medical staff in a smaller facility down there. As a lot of them worked in the community, did other things. When they got into the jail, they really loved the environment, the teamwork, the cohesiveness, and they really advocate for the field. And it's something Julie and her team are over there doing. Julie is the team really, but we all back her when she needs it. But that's one of the big things they're trying to push out is just that awareness, and the videos are really good. I think the stuff you're working on, Julie, is fantastic. Getting the information out and getting those testimonials as well from our folks that are at the conferences are big. So thanks for what you do.
Thank you. In the exhibit hall, we'll be at booth 118. Everybody should make sure to come see me. I'd like to meet all of you, and we're going to do a really cool activation there. Personalized cookies, selfie cookies. So you can come by and scan us or send a selfie through a QR code, and we'll get a cookie printed with it. So that's something really new and exciting for us to do in the booth.
Cool.
Yep, it'll be fun.
Awesome. Julie, thanks for being here as well. All right, so we'll go into NCCHC. Are there any questions at all as far as foundation? I didn't ask about questions after the education either. Are there any questions about either of those two before I move on to resources? All right, hearing and seeing none, we'll go ahead and move forward here. So NCCHC resources, I mentioned them earlier. They are our consulting affiliate. We do nationwide, just like we do as an organization. They are also nationwide as far as providing consulting services to jails, prisons, juvenile facilities. They're basically supporting that constitutional level of care. Everything they do, the foundation comes from these standards, just like our accreditation program, just like anything we do. The standards is the foundation of what they do. They get hit up a lot for training, as I mentioned, but other things that they go in and do is we have a lot of experts come from different areas. So when jails are having challenges, whether it's a mental health program or whether it's a crisis intervention, suicide prevention, things like that, contract monitoring is a big one to make sure contract is being met. We do a little bit of everything with the organization, and we work very well with our partners and provide some great services there. Some of the projects I was just talking about, the evaluations have been a big one lately with coming in and evaluating systems. As we know, there's a lot of challenges out there right now. You have a lot of the substance use disorders, and you have the chronic mental health care, the lack of mental health care in the community where people are coming in. And those are a lot of the challenges where people are asking us to come in and take a look at their organizations to see what they're doing and provide any type of feedback to improve the delivery of care. So they do a very important service there, Fred and his team. And we'll go ahead and give their contact information here. As with everybody, we're going to be at the exhibit hall. They'll be at 110. Fred, Loretta, and Claire will all be on site. They'll be able to answer questions and talk to you about any challenges or just curiosity that you have as well. One thing I didn't mention for accreditation and resource also, we're always looking for consultants and surveyors. That's something that we did have something come out about, I don't know, what was it, about a week or two ago, Kim, about the surveyors doing the recruiting again? So we're heavily in need of surveyors and consultants at all times. So that's something else to have a conversation about while you're there if it's something you might be interested in. We can tell you how that process works. All right, and then just in general, if you wanted to get started with something, you need to make some kind of change, or you want to have answers to questions about what you can do better, I'm always available as well. I'll be there at the conference. I have times available at the conference. I have my calendar link right there that actually links directly to my calendar if you wanted to meet. But an email went out on that last week that Kim pushed out. If anybody has any general questions at all, or they just want to know about our services, I'm also available as well. The advantage with going to the conference is everybody's here. So you're going to be able to talk to the specialized folks as well and get those direct answers. So, but I'll be happy to talk to anybody as well if you have any questions for me. All right. So the big thing, closing this out, one of the courses I teach, I talk a lot about the collaboration. And, we have different disciplines obviously involved. We saw from our poll, there's a variety of folks here. Might be your first time here. It might be overwhelming because of all the information. One thing I do find, I think Kim and everybody from the company will agree, is it's very easy to sit in your own situation and you look at it and you think, I'm alone with this. I'm dealing with challenges. People don't really understand what's going on, and you come here to seek answers. You're going to get that, because I will tell you this: if there's one thing that's true, we all deal with very similar challenges. It might be on a different scale, but you're going to find professionals here at this conference that are like-minded with you, that are wanting to improve services. And you're going to find people that are dealing with the same types of challenges you might be dealing with, or maybe you've got some answers to their challenges and you'll be able to help them out with that as well. So take it in and enjoy it. It's a great get together, and we're looking forward to seeing everybody on site. Thanks a lot.
All right, just 2 more slides. This is a link to these slides. They are loaded already. We will be sending out a quote unquote know before you go email on Monday, and it will have a link to these slides as well as a link to this recording. If you're in a hurry, if you go to registration on the website, right under that link, there will be these slides and this video as soon as the taping finishes up. I had one more question come in directly, and that was about getting the candidate handbook for CCHP. And that is free. You can go right on our website under that CCHP section, and you will find for every single program, there is a free candidate handbook for download for PDF that you can get to. So if you can't find that or you need more information, just email us either info@ncchc.org or cchp@ncchc.org. So we don't do a formal evaluation, but we do like to hear if this presentation met your needs, and we'll try one more time. Launch this guy. And if you have any suggestions for information that you would have liked to hear during this during this presentation, I'd love it if you put it in the chat. Or, stop by the bookstore and let us know, but everybody liked us. So that's pretty awesome. I always like the it should have been an email. So which nobody reads. So we really appreciate your stopping by. Appreciate the time that you've put in. We just had one of our scholarship winners put her name in the chat, which was fantastic. And she's looking forward to meeting everyone, and they're looking forward to meeting you as well, and your 14 other fantastic scholarship recipients who have wonderful stories about how they got involved in correctional healthcare and why they're interested in the field. So this is my information. This is Rich's information. We'd love to hear from you after the presentation, if that's more comfortable for you. We can stay open for a little bit longer if there are any additional questions, and we completely appreciate you. Thank you so much.
Thanks again, everybody.
Hi, can you hear me?
Yeah, hi, Emily.
Hi. There was one question in the chat that wasn't answered, and I'm kind of curious about it too, is what is the recommended time to prep for the CCHP?
It kind of depends on how good of a studier you are. The test is extremely linked to the standards. So if you can read and understand and remember the important parts of the standards, it will be the juvenile standards and then your choice of jail or prison. So thoroughly reading it, understanding it, maybe going over it with a colleague, and then the webinar or the class, I think would put you in terrific shape. Outside of that, it's kind of a matter of how much retention you have of the material. So, but they're not trying to trick you. It really is pretty much, what the standards say. I don't know, Rich, since you've been through it, if you have any study tips.
And I had responded directly to Shellamar on that. I should have just done it in the general chat, but it really, like Kim mentioned, it really depends on your familiarity. But I believe once you actually submit the application, I think it's still within 6 months you have to actually take that test. But they do extensions if things come up. But I would recommend, just from taking it, you really want to be familiar with the standards first. before applying, because it is a lot of material. We're balancing full-time jobs and stuff too. So you do have to commit some time in there if you're not familiar with them. And there are other resources as well. Like Kim mentioned, the juvenile standards are in there. And then we also have a best practices study that is free. That's actually downloadable, but it's about a 500-page book. And there is content out of that on the test. So yeah, there's some material to study. So it really depends on familiarity and comfort level test.
We're working on reaccreditation and because we opened a new facility and I'm
Right.
in charge of that. So I'm about to get real familiar with all the standards.
Oh, outstanding. Well, that's great. Do you have any
So-
questions? I mean, you guys already work with accreditation on that. So Amy and her team are excellent over there. Wendy as well, is one of the main on that. So congratulations working on that.
Thank you guys so much. And I was just wondering, I mean, if I would be ready by Vegas or not.
Realistically, yeah. If you're look, obviously you've studied, you've got your degree, you got that studying about you. It's just really, if you haven't studied in a while, getting back in. But if you're doing really good practices at your facility, if you're in the middle of becoming accredited, you might be a little bit better off than you think.
Okay.
Really, it's the ones coming in cold that are not accredited and they've never really seen the standards. We say, you know what, before you just rush in and apply and try and get in, you really want to make sure you familiarize yourself and do that. The fact you're already kind of knee deep in it and working toward that, you're probably going to be a little more prepared for that than you think.
Real knee deep.
Yeah. Oh yeah. I understand. And
Okay. I look forward to meeting you guys and thanks so much.
Thanks, Emily. We'll see you in about a week.
Yeah, sounds great.
We had one more question came in direct and about retaking the test, and I don't have those details on off the tip of my nose. I know they're on the website.
I
If
don't,
you-
was that further up? I don't see the one about retake.
It was direct to me.
Oh.
I would ask you, Shalimar, to go ahead and just email, and I'll just put their email in there, cchp@ncchc.org. And that way you get the best information possible. All right. Thanks, everybody.
All right. Everybody safe travels. We'll see you soon.
Bye-bye.
Hi, guys.